the structural logic of it. It made so much sense as to why women were having pelvic pain and infertility issues because of a possible malposition of the uterus or an obstruction of blood flow, an interference in circulation. And I'd seen that so much in my practice that it made so much sense, and I was absolutely intrigued. Literally the day I saw the article, I think I emailed Dr. Mercier and said, sign me up for this class.
Noticing the correlation between the imbalances and the lack of blood flow and what that meant even to hormone production, to just cycling, infertility in general. I mean, it blew me away. The very first patient, I tell the story all the time, that I saw after being trained, had her 8 o'clock in the morning on Monday, no period, 18 months, barely demoed the technique on her. Next morning she had started her period. So that was exactly the correlation I needed to see immediately following the training, because being someone that deals with those correlations on other levels anyway, and then having it pop in so quickly, it was like, oh, this makes perfect sense. Restore the blood flow. We do it for a myriad of other things, a shoulder, a neck. I mean, the muscle is the same. And so that correlation was pivotal for me to jump in and completely revamp what I did in my practice.
The patients suffer a lot of trauma with being told that they have infertility. Also, whenever women have dyspareunia or they have interstitial cystitis or PCOS, they're dealing with a trauma, and it's an emotional trauma also. I believe if we can help them with that, then we're going to change somebody's life. We don't just change their lives. Sometimes we change their husband's life, their children's lives, because the mother gets in a better state of mind.
Yeah.
So it changes people's lives.
It's such a support on such a varied number of levels. You're serving them physically, you're serving them spiritually, you're serving them emotionally. Sometimes you're serving them psychologically and you don't even realize. It's almost an unconscious act of power. Just to listen to their story.
I've seen it not only help women to become pregnant and start a family, or have, for secondary infertility, to have another child, but I've seen it help women get their lives back that did have the dyspareunia, and they got their families back. I had one woman that told me that she had so much scar tissue within the abdominal wall that she couldn't even walk to the mailbox and back. She couldn't have intercourse with her husband. She said she laid in bed day after day, very depressed, got very overweight. I worked on her. Not only did she get healed with the dyspareunia, she was able to have intercourse again. She's already ran 3 marathons since she's been done. She goes hiking with her kids. They canoe, they kayak, and she said her kids got their mom back, husband got the wife back. I mean, it just changes their lives, So.
Yeah, improving the quality of life is probably one of the biggest things.
It is.
I mean, whether you're talking about normalizing somebody's irregular period, taking away breast tenderness, helping them cycle or ovulate, what we do for a lot of these women that come in that have been through, multiple IVF attempts, and they come in and they don't have any hope. They're sort of beaten down, and then, I'll never have a baby, and then, a couple months later, I'm pregnant.
I've seen desperation and, deep sadness and desolation. And for someone to say, your body's a powerful machine. Your body can heal itself. I'm going to help you do this.
Yeah.
They light up when I've noticed when I'm working with a woman and I say to her, here's your ovary. She lights up.
Yes,
like
that connection.
The connection is, and then the power, the self-empowerment to say, yeah, I'm whole. It's here.
Yeah.
Well, I say if you want to help people and you want to change their lives, if that's what you are all about, then this would be a great class to do that with. And it's just empowering, and financially it helped me tremendously. I moved from one location to another, started a business 2 years ago, and had it not been for the Mercier Therapy and for the Mercier clients, I don't know that I would have made it. And the Mercier Therapy was a major boost in that business. And once someone got pregnant, it just dominoed, and I've had great success. In 2 years, I've had a lot of, 15 pregnancies out of 22 that have finished with infertility.
The effective nature of what we do and the fact that it's safe and that there's really little to no long-term
Right.
ramifications from the technique. You're overhauling their body in a way that's very beneficial for the long term as opposed to doing things in the short that will be more damaging.
Their side effects are only going to be what they want.
Yes, that's right.
Which is a pregnancy and to be happy and healthy, and that's their side effects. They're not going to have anything else.
I had no idea what Clomid did or that IVF actually punctured the ovary. Like, I never thought of it that way. So to have this information that is very empowering that most of the masses don't know about was really impactful. So I am very motivated to share this education and this knowledge with other teachers so that they then can pass on the work or help heal someone or allow a couple or a woman to experience the primal human experience of creating a child.
Yeah.
Right.
Or to be relieved from something that has affected the quality of her life for so long.
Yeah, I think I would encourage people to take the class because the way that it's formulated will give them something that they can take home immediately, implement into their practice, something that's effective, something that's safe, something that does, like you said, empowers people to have an understanding of what's happening in their body, because most people are lost on that. I mean, they don't, everything, whether I tell someone to have a glass of water or take an ibuprofen, there's a risk to benefit ratio of doing that. And people are not always informed on how to make the best decision, and you don't pull out the nukes to start a war when you can send diplomats in. So you want to do what the Hippocratic Oath, first do no harm. And so to start off doing something that increases circulation and restores blood flow and reduces inflammation and stimulates a healing response is extraordinary when you have something as effective as Mercier therapy to help women and families grow.